Our guest today is Dr. Libby Wilson. This is another exciting conversation with a doctor who turned away from conventional medicine practice to open a functional, patient-centered medical practice. There's so much to take away from this conversation. How to take a bold leap but do it in a way that is pragmatic and sensible. How to use health coaching in a medical practice, or how to be a health coach in a medical practice. How to make the right investments of time, money, energy to grow your business, and tons more. Let's have a listen. Hi, I'm Erin Power.
And I'm Laura Rupsis.
We're certified health coaches, and this is Health Coach Radio.
This podcast is about the art, science, and business of health coaching.
We share our insider tips to help you become a better coach and entrepreneur.
And we interview expert guests to discover how they've made it in this growing field.
It's time for health coaches to make an impact.
It's time for Health Coach Radio.
All right, peeps, we got Dr. Libby in the house. How are you, Dr. Libby? Thanks for joining us.
Yes, I'm great. Thanks for having me today.
Oh my gosh, we're so excited. We love having health practitioners, licensed practitioners in here talking about the state of healthcare and what you do and how you're just trying to deliver a better solution to patients and clients. I'm not sure. I'm assuring you refer to them as patients. Health coaches refer to them as clients.
Yes.
I would love to actually, that's something we can talk about too, is kind of language when a health coach is working within a practice and what that looks like. But as always, we like to kick off with you. Tell us your story and how you got to be Dr. Libby and a functional medicine practitioner.
Yes, great. Well, thanks for having me. And I feel like I'm coming home talking to people like you, because I'll tell you, I feel a little alone in my world of functional medicine. I came from the conventional medicine world. So I went to medical school. I became a family practitioner, and I had this audacious goal of helping people be healthy.
What?
Yeah, I thought, this is great. This is what I'm wanting to do, right? And it was actually quite devastating to get through all that training and realize, A, I didn't know how to help people be healthy from all the training I received at all. And B, the system was not set up for me to be able to deliver that care, even if I would know it. And, it takes about 11 years to get through the training to become an MD, 4 years of college, 4 years of medical school, 3 years of residency. So you're basically 30 when you get out. At this point, I start having my babies, and there's just no time to really do it differently. But it was really kind of heartbreaking to see, this is not what I thought it was going to be. And so I went on my own health journey. So I kind of felt like I lived these two separate lives, right? So in the mornings, I'm going to the gym and exercising, and I, trained for marathons, and I did all that kind of stuff for myself. And I studied nutrition to learn how to eat healthier. But that was all on my own. And then I would go to work and I would, see a patient for 10 minutes, and I would diagnose their problem, and I would prescribe them their pill, and I'd go on to the next room. And it just felt very inauthentic.
Mm-hmm.
And, but I did that for 15 years. I was a family practitioner. And, I remember one day I went to the gym. I went to a CrossFit gym, and there was a poster hanging up in the gym that had just been placed there. And it was from an elite CrossFit coach named Ben Bergeron. And it talked about the 5 factors of health. And they were diet, exercise, sleep, mindset, and relationships. And I, at this time, had started taking some functional medicine courses, actually trying to find some solutions for my daughter who was having stomach problems that, as a family practitioner, I did not know how to address. And those were the same 5 principles I was learning in functional medicine too. Mm-hmm. And I just remember thinking, this is so simple, but it's just so not the way that I deliver the care. And I'll tell you, there's moments in your life that change you. And that was one of those moments. I left that gym that day thinking, I am going to do something different. I don't know exactly how I'm going to do it yet, but I am going to do something different. And so I'd taken this first course in functional medicine, I think right before that time. My daughter, who was, elementary school, was having stomach problems. I, as a family doctor, I thought it was irritable bowel syndrome. I gave her some medicine for irritable bowel. Didn't work. Ignored it for a while because it kind of came and went. Eventually took her in to see her family doctor, who was one of my colleagues. I thought maybe I'm just the biased mom and can't figure this out. My emotions are just playing too much into this. She agreed with my assessment. We tried a different medication. didn't work. Took her to see a specialist. They did a stool test, blood test, spent a lot of time with her. Nothing's wrong. She's fine. I knew she wasn't fine. There was something wrong. And that's when I started hearing about functional medicine. I took a GI course and I learned within the first day of a 3-day conference what I was pretty sure she had. And of course, I ordered a test and confirmed it. And then I treated it and cured it with a functional approach with dietary modifications and some natural supplements. And I began to think, maybe there are some answers. Maybe I just haven't been taught in the correct realm for what is going to be authentic and true for me. So I dove in with both, just both feet and really started learning all that I could about functional medicine. And about a year later, I started a side hustle. I basically started my functional medicine practice while I was still working in my family practice. I tried to integrate the two together, but that was impossible. I mean, you're already so rushed for time when you're seeing these patients. Mm-hmm. And shockingly, it took off so quickly. Within 3 months of starting the functional medicine practice, I was seeing so many patients, and I left my family medicine job behind, and I started my functional medicine practice full time. And I've been doing it for about 3 years now, full time.
Wow.
Gosh, I got so much, Erin.
Oh my gosh.
Start. Yeah. Okay. I'm sure you have the same things.
Oh yeah. We were going to gab.
I saw you guys writing furiously.
So 3 years you've been in this functional medicine clinic. And so this is an in-person clinic, is it?
It's a virtual online clinic.
Virtual clinic. Great. Mm-hmm. Okay. So it took off immediately, you said. Mm-hmm.
Yeah.
Why do you think that is? Is it patients recognizing that they're fed up with the system too?
Yeah. I was shocked at how quickly it took off. I think there is just a small segment of MDs who have seen the light. Mm-hmm. There's other holistic providers who've been doing this kind of work for a while. And these are now the people I consider to be my colleagues, the chiropractors and the health coaches and the holistic healthcare providers and the naturopathic doctors. But I think, already being well known in my community for being a doctor and, being a caring, compassionate doctor who really tried to listen to their patient. I mean, I definitely had that reputation. So when I took this career shift, there was a bunch of people that kind of said, I want to be a part of that. And so it really took off quicker than I thought. But I do think, there's 1,900 certified Institute of Functional Medicine providers in the world. And only 1,100 of those are MDs or DOs. In the world, so there's just not very many. So I think that is what made my career success so fast.
Yeah. Mm-hmm. Yeah. The reason I asked that question, why do you think it took off so fast? So what I'm hearing is that you had a history of being a caring physician, and so people were already kind of in your orbit. But my curiosity always is just from health practitioners, licensed practitioners. Are you seeing a shift generally? Because you've been in practice for a long time, conventionally, and then in functional. Like, are we seeing a shift in what we call the health consumer, like a more empowered shift? Like, I haven't been getting results going to my traditional doctor who keeps just giving me pills.
Right.
I want to understand my body. Like, I'm just wondering, are we seeing a shift in the health consumer? Would you say?
Yeah, I think so. And I definitely think over the last couple of years, that's even accelerated, with COVID, and just people are sick and they're afraid and they're not sure what to do. I think there's a level of distrust in the conventional medical system, and people are just, they don't feel good and they're not getting answers. And so they're starting to look elsewhere.
Yep. Oh my gosh. So, I have 4 children. My 2 little ones are 8. They're twins. And little Sammy, they both kind of had something's going around here, right? But one responds differently than the other. Charlie has a little cough, stuffy nose, but otherwise fine. Sammy spikes this huge fever over the weekend, 103. She was under the blanket, 104. It wasn't coming down enough with just some, that high. I was going to treat that with some sort of analgesic.
Sure.
But anyway, it kept spiking. So I took her into the urgent care near me because my fear was, I wonder if whatever was going on virally spiked a bacterial infection in her ear. And I just kind of wanted them to kind of take a look. Sure. So I walked into that clinic, and this one doctor walked in, spent 4 minutes. I timed it, Looked in her throat, looked in her nose, mumbled something that I couldn't understand. He spoke with an accent I had a hard time understand, and said something about her ears, but didn't specifically say he thought it was an ear infection. Antibiotic, walk out the door, and I'm like, I thought they weren't giving antibiotics for ear infections necessarily anymore. But I was talking to a neighbor of mine. She's like, oh, I never go to that. This is now the reputation that doctors like this have.
Yes.
It's almost as though I was talking with my friend, like, as parents, we have to kind of act as that first line of medical defense. And I'm only going to take my kid to this other doctor if I think I know what it is. But the knee-jerk reaction, to your point, is 5 minutes pill, move on to the next patient. Yeah. This same doctor also misdiagnosed my husband, said he had a pulled muscle when it turned out his entire bicep tendon was torn. Literally apart. Okay.
Yeah.
So this is this sort of model that we're in, where you only have a finite amount of time, and you do it. I heard you say it. My job as a, family medicine doctor versus my practice as a functional medicine practitioner. I caught that distinction because I'm now thinking that a lot of doctors that are in that model, that's what it's become now. It's not this private practice of healing people. It's this job. It's a patient mill of people that are just sort of walking forward. But here's the thing. This is what I'm hearing from people but they don't take insurance. And how am I going to be able to build a practice if I can't take insurance? And this comes up with health coaching as well, which is why I'm asking this question. So we're asking people to sort of extricate themselves from this sick care model that serves no one.
Yes. Right.
And we're asking them to take matters into their own hands and seek out a practitioner that's going to work with them to actually heal them. But here's the catch. You got to pay for it.
Right. Absolutely. The thing is, insurance companies don't care about getting you healthy. They care about saving money. And so as long as we stay trapped in that health insurance model, no one is going to get what they want. Because, when you have that 10-minute visit with your doctor, what they were doing when you went to the urgent care with your child was they have to check these boxes to get paid for the visit. There's all these elements of the visit that have to be documented. You don't care about those elements. Your daughter doesn't care about those elements. The doctor doesn't really care about those elements. It's like, how long has it been there? What makes it better? What makes it worse? What have you tried? Like the symptoms, the duration, the exacerbating factors, the relieving factors, all of this has to be documented. No one cares, right? we care about like, what is going on with my daughter and why are they not feeling well? But first and foremost, we have to figure out what the insurance wants us to do, or no one gets paid. I mean, you can't have a business if you don't get paid. And so that's the way the system works. And the thing is, in conventional medicine, everything gets an ICD-10 code, right? So you come to see the doctor, they're filling out these codes. There are 72,000 codes. So doctors become very good masters of labeling what you have and then matching the label to the pill, and out the door you go. Our bodies are designed to feel amazing. And when they're not feeling amazing, there is a reason. And there's not 72,000 reasons. There's really only a few major reasons that are actually the root cause of what's causing people not to feel well. And when you can partner with someone who knows that and can care about you and walk beside you and help you figure it out, instead of labeling it, prescribing a pill, and getting out the door, you can have real transformational health. But it's not what the insurance company cares about. The insurance company cares about saving money. And even the insurance company doesn't care about keeping you healthy in the long run, because guess what? Most people's health insurance comes from their employer.
Right.
And most people don't stay in their job forever. They anticipate by the time you get really sick and you're going to really cost us a lot of money, you're probably going to have a different insurance company carrier anyway. So all we care about is our bottom line today.
Yeah. And Erin, I got to imagine this is almost so piggybacking on this and how you make the transition from the sick care system being paid from the insurance company to a well care system where your clients are paying out of pocket. What was that messaging like? Because I got to imagine this is even harder in Canada, Erin, where it's universal health care. You pay a big nut in taxes. And I got to imagine there's got to be even more pushback there.
Yeah, well, so I always struggle with this conversation when we talk about it because the insurance company corruption piece just isn't a thing. I mean, we have extended health coverage. So for things like physiotherapy or, vision, you'd pay, that's an employer sort of subsidized thing. But I can go to the doctor and get a checkup and get pills for free. Well, the pills aren't free, but so I think about, like, for example, family and acquaintances of mine who it's very, very hard for them to extricate and feel and take that empowerment because they're not paying anything out of pocket. Nobody's paying anything out of pocket. I mean, we all are in taxes, exorbitant amounts of taxes. But,
right.
What you're talking about here, you said two things when you were sharing your origin story. First of all, you didn't learn how to help people be healthy, and the system's not set up. That's true of doctors conventionally everywhere, I would imagine. I can say the few times I've engaged with the Canadian healthcare system, I've not been helped. It was free and I did not get help.
Right.
So the system is broken anyway.
Absolutely. And we were chatting right before the podcast was, going for a cruise in hurricane season is cheap. Well, I mean, healthcare is sort of, it's free and it's sort of cheap too, but what result are you getting? I mean, I think about this when I think about supplements, and the supplements that I recommend for my patients are high quality medical grade supplements, not the cheap stuff that you can buy at the discount store down the street. And they're more expensive, but I think the most expensive supplement is the one that doesn't work. I mean, if you pay $10 for something, but it does nothing for you, that's a waste of $10. It's the same thing with the free healthcare system. If you're not getting anything from it, it's actually kind of expensive. I mean, even if it costs you $0, it costs you your time, which is your most valuable resource, right?
30% of your income.
Yeah. I mean, it's just, it's, I don't know, not everybody understands that. And not everybody ever will, but you know what? There's enough people that do, and enough people that get it, that want that kind of care, that are willing to say, you know what? Yeah, like my insurance is getting me nowhere. Let me look outside the box and see what I can get from kind of fracturing that relationship and taking my health into my own hands.
My hope, I guess, is that as we go along here, more functional medicine practitioners come online. Hopefully we get more than 1,100 in the world soon. I think the hope is that the messaging becomes more prominent so that health consumers, again, can just know that there's options out there. So I feel like health coaches, we're out here, peddling our wares, as it were. But there's still that population that wants to trust the doctor. They're not going to leap to a health coach right away. They want to go through the medical system. And so I think that functional medicine is the entry point to getting people well.
Yeah, I 100% agree. And, another thing I was thinking about was people used to come to me for physicals, and this was like a big part of what I did. And I remember, especially my healthy clientele that came to me, I can picture this one particular gentleman as I'm telling this story right away he was an Ironman triathlete and had a really clean diet, and he thought he was doing something for his health by coming to my office once a year for his physical. And I remember just feeling like completely inept, like this is doing nothing for him. I'm listening to his heart and I'm listening to his lungs and I'm tapping on his knees for his reflex and looking in his ears. And I'm checking some very basic labs and telling him he's great. And then he leaves the office feeling like, oh, good. I'm doing something here. Even if he was of the age where he needed prostate cancer screening, colon cancer screening, none of that is really making you healthier. I mean, it might be detecting disease early, but it's not making you healthier. And that's just where medicine falls short. And I'll tell you, what I want for myself and for my patients is I want to prevent disease. I want to feel amazing. I put a lot of effort into my health. Like I think I should be getting some amazing results for that. And the truth is there is a lot that can be done, a lot that can be peeled back when you dig to the root cause and really look at it. But I'll tell you, functional medicine cannot deliver it alone. They need a health coach or health coaches by their side to partner with to help implement the plans. In my practice, I call it strategy sessions that I have with my patients where we have a lab and I interpret the lab. I explain in detail to the patient what's happening because I tell my patients, I'm the expert in the medicine. You are the expert in you. Let's put our heads together and look at these labs and figure out what's happening in your body and come up with a strategic plan on how to fix that. And then I give them to my health coach and I say, help them implement this plan and come back to me in a couple of months, because they can't implement it on their own. They need to dig deep into the why. They need to figure out what is important for them to stick with this plan and what they're hoping to achieve. And they need someone to kind of cheer them on and hold their hand and help them through it, because it's not easy, And so functional medicine cannot do it alone. Health coaches are so incredibly important to the success of patients.
I just have to say that you absolutely nailed it. Like I teach an advanced health coaching course, and literally one of the concepts that we teach is helping the client patient recognize their own, what they bring to the table. So what you exactly said, I'm the expert in medicine. You're the expert in your lived experience, your schedule, your likes and dislikes, what you can do, what you can't do, what supports you have at home. Yeah. And that collaborative effort, that co-creation of strategy is what empowers and enlightens people and makes them well. I just think you got it. You nailed it. You figured it out.
Yeah. And I love that you say that from your point of view, because I think we find this in the health coaching realm, where health coaches somehow feel like they need to come forward as some expert rather than a part of a team, and it's like, God, get rid of that. That's where all the imposter syndrome comes from. They're trying to put themselves out there as an expert, but they don't really feel like an expert. And I'm like, an expert in what? What are you an expert in? Right. Because at the end of the day, what we're here to do is to help facilitate change. That's what coaches do. Right. You've got this doctor and the patient that are working together on your strategy session on what works. And so now this is where the health coach shines. You are the change. If you're going to be an expert in anything, it's an expert in change and how to help your clients change, because this strategy is going to require a lot of change for a lot of these people moving forward. And I love that you come forward so humbly saying, look, this is what I know. I can help interpret this stuff, but you know your body. I don't know what it's like to live in your body. Let's work together. And then we're going to go sit down with the person who really can help you figure out how to facilitate this change. This is where this is so important and how all of this comes into lockstep. And we were talking about this before we recorded, that what I envision moving forward in terms of health coaching growth, because what we've seen just professionally with health coaches is the vast majority of health coaches quit too soon. They leave the industry before they ever really find success, because they anticipate this massive, wonderful practice of like 6 figures in a year. And then they don't get there. And, they give up too soon. But I think this is going to be the path for many health coaches to get where they want to go, because it's so needed.
If there's one thing I've learned in my years as a health professional, it's that changing lives is much easier when you're doing it alongside a team of experts. Physicians, nurse practitioners, and other care providers have learned this too, which is why they're looking for health coaches just like you to join their medical patient care team. Primal Health Coach Institute's Health Coaching in Medical Practices Specialist certification prepares you for that. You'll learn how to work alongside a clinician and advise and motivate patients to change unhealthy lifestyle habits and manage chronic conditions. By the time your studies are complete, you'll be ready to secure a position at a practice that fits best with your coaching style, and you'll have the tools you need to plan programs, accept referrals, and coach patients. If you're a health coach with a passion for helping patients get the life-changing information, encouragement, and accountability they need to make sustainable changes in their health, visit primalhealthcoach.com to learn more about the Health Coaching in Medical Practices Specialist certification.
I heard you say, I didn't know how to help people be healthy with the training I received. And we have interviewed many doctors who have all said the same thing, but there are many, many out there, far more that are out there, that are somehow conflating treating an illness with helping people be healthy. And I don't want to Erin's point, I don't want to doctors, they're so important. They serve this vital role, but there's a difference between treating illness and actually helping someone be healthy. So was it these functional medicine courses that you took that kind of switched? Was it I guess I would just love to hear from you sort of the steps that you took to move this way, because I do think health coaches can use your story as a way to be like, I had a personal situation with my health. And in your case, it's your daughter. And then I went out and tried to figure out what I didn't know to try to solve the problem. And then this has led me to this new desire for a different kind of career. So you took some functional medicine classes, tried to implement them within the system you were working in, realized that's not going to work. So you decide to go start your own practice. So you said this took off within 3 months. Would you mind sharing with us kind of the logistics involved in getting that started? How did you advertise? How did you get the word out? Did you stumble over this? But do you take my insurance conversation?
Oh, yes. I still
and
stumble
how did
over
you
that.
overcome that? Yeah.
Yeah. I think first of all is I invested heavily in what I didn't know, right? Okay. So I did not know functional medicine. I did not know nutrition. I did not know, how to walk along beside patients. And I didn't know how to run a business either. I didn't know any of that stuff. And so I found some mentors that helped me. So I took the IFM certification pathway, which is great, but it was kind of like med school. It was like all this great information, but I'm like, how do you actually implement this with patients, right? Like it was exciting to know, but I really didn't know what to do with it. I believed in it. I thought, oh, this is the answer, but how do you actually do this stuff? Yeah. Same thing with like a business. Like I'm like, I did own my family practice. So I did have a little bit of business management skills from that, but it's an insurance-based model. That's easy, right? When the insurance pays for it and it's free, like the patients just come. So I really didn't feel, so I hired a business coach. I hired a mentor who showed me how to implement functional medicine principles. And, so I invested a lot on the front end because I realized there are people who've walked before me. I may be able to figure this out on my own, but it's going to take me a long time. And guess what? Other people have already figured this out. And what I've learned is there are, everybody is an expert in something. We all have our secret sauce, right? It's just finding the right people. So I invested heavily. I figured out what I wanted before I ever started. It was very well thought out. And then I did it from sort of the comfort of having that stable salary still coming in, so I worked in my family medicine practice 4 days a week. I think I was off on Wednesdays. And so I started doing these free sessions with patients on Wednesdays and Saturdays. And I remember my husband telling me, God love him, we've been married for 25 years. He said, like, Libby, I just don't know that people are going to pay you cash for this. Like, it just doesn't seem like anyone's going to really do that. And I said, I don't know. My just intuition is telling me that people want this. And the good news is I can just keep doing my other job for as long as I need to. Yeah. And I had that first call on a Saturday morning. I launched my website like beginning of September 2019. And that Saturday morning, I had a first call and I had planned out how I was going to explain to the patient, what I was going to say. And guess what? This patient had been to all the different doctors. I mean, she'd seen the specialist, she'd been to everyone, and no one had given her any answers. And I provided her with some hope. And at the end, I offered 3 different levels of a package at that point. I've changed around a little bit since then. She said, yes, I want to do it. And she signed up for my most comprehensive package. And I thought, maybe this will work. And the second patient, the same thing. And then the third patient. And before you know it, before I knew it, I had to do something different because I had so many people depending on me now in this new practice that I couldn't give them the time I needed if I didn't back away from the old practice. And so I was able to make that transition. But I trusted the experts. I trusted people to show me the way. And I've always believed in the fact that we all have something special to offer. So we just need to partner with the right people. And it kind of comes back to the health coaching bit. I remember when I was a family practice doctor, there was a little kid that came in for a flu shot. The mom had scheduled a flu shot for him, and the kid didn't want the flu shot, but the mom was saying, yes, you're going to have the flu shot. And the little kid trusted me, and he said, okay, I'll get it, but I don't want the nurse to give it. I want you to give it to me. Aww. And I told the little guy, I said, listen, you really don't want me doing it. Like the nurses give shots all day long. The doctor doesn't give the shots. Like, they give thousands of shots to the one shot I give. Like, they are the expert. You want them to do it. And I convinced him and the nurse did it. But it's the same thing with the health coach. I tried to, in the beginning of my practice, be that too. I was like the doctor and I tried to be the health coach too. I think I was like, I'd give myself like a C- at it. Like I was not the best at it. I'm very much like, here's what you need to do. Do it.
Yeah.
Why aren't you doing it? And my health coach is much better at helping people move forward, finding their why. And so I don't look at it as we just look at it as we have different skill sets, right? And mine aren't more important than hers, and hers aren't more important than mine, but we complement each other because we both have different areas of expertise. So I hired the experts. I let them show me the way instead of figuring it out myself. And I think I attribute that a lot to my success.
Honestly, it's a masterclass in exactly what to do. So I just want to recap for everybody listening. So first of all, you had a clear vision for what you wanted, started with a vision. You staked your claim. You knew you had something special to offer. You maintained your full-time job while you built it. You paid for help, invested up front, got business coaching to shore up the areas where you knew you didn't have what it took immediately to build this because you still had your full-time job. You could afford to do that. Then you got your first consultation. On that call, you provided hope. You didn't go into that call selling. You offered hope. Offered the package. They bought the most comprehensive one. To me, that's like when we teach health coaches how to go to business for themselves, it's like, yep. And so just wonderful. The thing is, when a health coach listening to this podcast interview is listening to you, a doctor, and thinks, well, she's a doctor. That's, it's easy for a doctor to just open a new practice, but no, you literally did all of the basic business building things that every entrepreneur in any category should do. It's literally 101, how to go to business for yourself.
Yeah.
And so then as business grew, you realized what you needed was somebody to help with implementation. So the health coach came in. So can you talk us through in your practice, how does that go? And the reason I'm asking is because we've had a lot of conversations with functional medicine practitioners who use health coaches. And sometimes the doctor is the entry point to the relationship. Sometimes the health coach is the entry point. How do you work out your relationship with your health coach?
Yeah. And she's a private contractor. So she has the ability to do other health coaching too. But interestingly, I hired her as a personal assistant first. So she was in her health coach certification course when I was looking for someone to help me manage the day-to-day of my business. And I got hundreds of applicants because I have a virtual practice, so I can accept, people from all over as far as helping me run my business. And her application just immediately jumped out at me because she had the same interest that I did pursuing her health coach certification. She was very eager and she was an amazing assistant. And so as she completed her training, and at that exact same time, my practice was evolving to the point that I needed some help. She was the very obvious choice, but she's a contractor. So she has the ability to have her own clients too, if she wants to. Now she gets a ton of clients for me because it's not an option for my patients to work with the health coach. It's part of the program. Yeah. So they pay for a package with me. It includes my strategy sessions. It includes their lab fees that I think are very important, like these core labs that I think are necessary for all patients to have. And it includes sessions with my health coach that I feel are not optional, but very necessary. And it works. And so she provides those sessions. As a matter of fact, we've had the discussion, pretty soon she's going to be maybe overwhelmed and not be able to do that because now we've hired another assistant because she doesn't have the time to do all the assisting work and all the health coaching that she's doing. She still does a somewhat of it, but the plan for the future is to take all of those responsibilities away from her, except for the health coaching. And then there'll be a point where she won't be able to do all the health coaching too. And then we'll just add to the team. But my goal for her always has been I want to support her in whatever capacity that she wants. And you know what? I have a couple of patients who no longer work with me, but they still work with her.
Yeah.
Because they just see the value that she provides. So it's pretty amazing.
I just want to jump in because you had so many applicants. Hers jumped out because of an eagerness. Because I think that health coaches listening might want to know, what can I say on my cover letter? What should I be demonstrating that would get my resume noticed? Do you think of anything off the top of your, I mean, I know that it was just for you, it was sort of like there was a personal alignment. You had the same interests and things like that too.
Yeah.
What do you think? Do you have any like top 3 things that should be on the cover letter?
You know, what's so funny is I remember getting her application. Like I posted the job on Indeed.com, and I think there were like 200 applicants, and I quit looking after a while because it was just so overwhelming to look through all of them. But hers, I remember it was just a very authentic cover letter. I mean, we're taught so much that it's like, so fancy and professional and say this and say that. She wrote in her cover letter, I still remember this. It said, I saw this job posting and I literally was jumping up and down because this is exactly what I've been looking for. Like she wrote those words of something to that effect in the letter. And it just really stuck out to me because it wasn't like super formally or super fancy. And I mean, of course she had the nice fancy resume to go along with it and everything. But I remember printing it off. And at that time, my husband was working from home too. It was during COVID. And I went downstairs. My office is upstairs in our house. His office is in the basement of our house. I went down both flights of steps. I said, look at this. Like, this is the girl I think I want, Yeah. And I remember thinking I need to do my due diligence because, I don't want to just like reflexively give it to her. But so I did. I looked through for the next week, all the applicants, but hers really stuck out. And then I interviewed her first. And then I interviewed a couple of others who were really great candidates too. But she really stuck out. And it was just her love for what she was, for what I was doing. And just her like realness and her authenticity, I think is what really stuck out to me with her.
Great.
Yeah.
That's good.
Gosh, I just love that because, there are folks that go out to Indeed.com looking for job postings, and they, of course, click on the ones that are paying the most money, and they're like, well, I'm not they're all asking for an RD or a nurse or what have you. And I'm like, okay, so let's take a step back for a minute. Those jobs are paying that kind of money because those people invested in what they needed to invest in and have the experience and whatever they need to get that job. That's not you. You're not there yet. However, there's tons of jobs out there that are perfect for the person that's trying to build this practice. Like you as someone hiring an independent contractor to take over your clients, allowing this coach to be able to coach her own people as well. What a phenomenal opportunity. I'm hearing this from people all the time. Like, I'm willing to take a bit of a pay cut to earn what I need to pay my base bills. That's going to give me the time and the ability to actually build my practice. And I love that that's kind of where you found it where you posted it, where she found you, and that you were able to come to a mutually beneficial arrangement that serves you both. It sounds like. I run a webinar series called Coach's Corner, which is basically interviewing our coaches that have graduated from the program Erin and I work for, that are out there running a full-time business and are successful at what they're doing. And one of the things we were talking about is that getting any career up and running, you have to be able to invest something, money, time, and effort. If you don't have enough money, you got to be able to give it more time, or you have to put in more effort. Or if you don't have the time, you better have more money, or, it's like this sliding scale.
For sure.
To me, you were able to invest on the front end, which, by the way, anyone that's going to start a small business might need a small business loan to guess what? Invest in the front end to get your business up and running the right way. That more than pays for itself, and you can pay that back earlier. The other thing I heard was in terms of, well, who's going to hire me? Your husband saying, who's going to pay cash? This is a question I get from people that are interested in becoming a health coach is, who's going to hire a health coach? Who's going to pay out of pocket? And literally, similar to what you were saying with the people that hire me are the people that have been unsuccessful, literally trying everything else. Guess what? There's millions of them. There are millions of people that have done everything the quote unquote right way, or saw all the people they were supposed to see, that are still unhappy. Those are the people that are willing to pay out of pocket to work for you because they finally just want the problem solved. So this is where we get into the whole notion of you have to be able to solve a problem.
Yes.
You can't solve a problem, you don't have a business. So I would love to hear about your messaging, like in terms of kind of how your clients find you.
Yeah.
In terms of how you market yourself.
You know what? I think my secret sauce is boring, old, consistency. Like I am the most consistent person. Like, so I work from home and I work from like 9 to 4 every day. I mean, it doesn't matter. Like today I have 0 clients on my schedule, but I am dressed and ready to go. And I am in my office all day long doing it. And when I'm not seeing patients, I'm creating content. There is content that goes out consistently, a newsletter every 2 weeks, a blog every week. I do a Zoom call with my patients every week. So we prepare for that. I do a tip of the week for my patient. Like I'm just constantly, I know what I want to offer and I'm very consistent. I never, if I don't feel like it, I still do it anyways. Like that is a big part of it. But my messaging for my patients, really, most of it is, I'd say 75% of my patients are people who want to get beyond the line of fine. Like they've been told that they are fine. I was told that I was fine. I was far from fine. I mean, when I was 40 years old, I'm 48 now. When I was 40 years old, I went to my family doctor. I was like, I just don't feel super great. Like I'm eating well. I exercise every day. I have a loving husband, 2 amazing daughters. Like life is good. I'm not depressed. Everything is wonderful, but I just don't feel that great. Like I crash onto the couch at night and I don't want to do that. Like surely something's wrong. I was convinced it was probably my thyroid. Like everyone's convinced it's their thyroid, right? And my colleague and my friend did a physical on me, listened to my heart and my lungs, looked in my ears and all of that, drew the basic labs. And guess what? It was normal. And I knew that there was something not normal. And I knew I was not alone because I saw these exact same patients myself, 10 of them a day easily. And so when I started to learn functional medicine and I learned the adrenals and how they become burned out from chronic stress and how that can affect your sex hormones from your body deprioritizing sex hormones and making cortisol instead. And I'll tell you, I think the reverse of the placebo effect happened on me because I was still so conventionally focused at this point that I thought this stuff is never going to really work, even though I'd had this like N of 1 success story with my daughter and her gut issues, I still thought this will never really work. But I tested my adrenals and I took the supplements and guess what? Like after about a month's time, I started to feel better. And once I started to feel better, I felt like I wanted to shout from the rooftops, like I have answers for these things that we've all been feeling. And, if there is so much more than what conventional medicine has to offer. So that's my main messaging is like, there are more answers. If you are fine, there is more than fine. And instead of waiting for disease, let's prevent disease. So that's 75% of my patients. I would say the other 25% of patients are patients who are just not finding their answers in conventional medicine. These are the autoimmune patients. These are the patients like that very first patient I described who'd been to every doctor and no one's ever been able to help her. It's a harder road to walk. I mean, it takes a lot longer to really get some traction with some of those patients sometimes, but there are answers. I mean, your body is designed to feel amazing. And when it doesn't, there is a reason. And if the reason hasn't been found, they haven't looked hard enough. I mean, that's what I tell my patients. And so I just share with them regularly. And then the patients share with their friends. And I do a webinar usually once a quarter. I call it a workshop, but I do like a Zoom workshop and I educate people. I just teach them what I know and the results that I'm seeing. And that keeps it going. And, when you're having a cash-based practice, you don't sometimes need a ton of patients to make it work. If you're providing a valuable service and you get enough of them coming, and that's how I've made it work. But the consistency, I think, is key.
Oh yeah. Just so much goodness. The consistency is key thing, which is what you started with. There's just so many good things in there. You treat it like a job. You're sitting in your desk at your desk today till 4 p.m., even though you don't have any clients, but you're treating it like a job. I've got to write content. I've got to put some messaging out there. This is, I think, where a lot of people fall down.
Yeah.
They mentally treat it as, this is my side hustle. This is my side gig economy. And I know it's hard. I just want to say to anybody listening, I know it's hard, especially because as you're transitioning, you're probably still holding down your full-time job, but you do have to treat your health coaching practice, your private practice of any kind, as a job. And there's certain things you have to get done in your job, like creating content and, setting up systems and yes, seeing clients. And that's what we all want to do. But then there's all of this other kind of grunt work that has to happen too, which is also part of the job.
Absolutely.
Like doubling down on that.
Yeah.
If you treat it like a hobby, like I've heard it called a jobby before, like if you treat it like a hobby, it will pay like a hobby. If you treat it like a job, it can actually become your job. And, sometimes I realize I'm like, gosh, I have a really mean boss that I work for. That's myself, right? Because I'm like, I can't possibly, like run my daughter to a doctor's appointment this afternoon. I've got work to do. And really, it's like, no, I really can. But I you know what? It does not feel like work because I just love it so much. But you have to be like, I want my clients to count on that newsletter is coming out twice per month, whether I feel like it or not. And the tip is coming every week, whether I feel like it or not. Like that creates a lot of trust that they have for you when they come to count on that, week after week, month after month, that you're in this for the long haul and you're not going anywhere.
Yep. Yeah. So you said you have packages that people buy. Is that how that works? Someone signs up to work with you for a finite amount of time for this package and they can always re-up, or do you have any kind of like a concierge set up to your practice where people could just kind of pay a monthly, what's the word? A retainer almost, right? Can you speak to that a little bit about how you run that?
Yeah. So, I work with patients through a package and I offer them either a 4-month package now or a 10-month package. And the 4-month package is like the first 4 months of the 10-month package. So if they choose to, like, sometimes, they don't know me and they've never heard of this before. And they're like, yeah, I'm not really sure I'm ready to work with you for almost a year, but let's try this out first of all, is sort of where they will start with sometimes the 4-month package. And then once they've gone through the package, then I offer them some continuing care options, one of which is sort of a concierge medical service. So they can pay a small monthly fee to continue to be my patient. And, I try to sometimes do a little bit of the family medicine stuff in there as well. So, if they need they have a urinary tract infection, they need an antibiotic for that. I'm like, you know what, I can handle that for you. They get a yeast infection, something like that. I'm not big on prescribing medicines. I prefer a much more natural, holistic approach, but sometimes it's just necessary. And so if I can keep them out of the doctor's office and provide a service for them, I'm all for it. So I have a pretty large percentage of patients that kind of continue on that pathway. I always thought I would want about 50 patients. And I take about 12 every quarter. I enroll patients on a quarterly basis. And the goal is for them to kind of graduate and not need me so much anymore. But what's happening is every quarter, more and more stay. And so I'm not sure how that's going to transition into the future because I'm going to be at the point where I'm not going to be able to take too many new ones anymore. But there'll be ways to, I'll have to expand my business a little bit to accommodate that.
So do you see then a world where you might need another health coach? And how do you kind of pay your health coach, if you don't mind me asking? Do you pay her per session? Does she get some sort of like a little monthly salary? How do you?
I pay her a fee for an hour-long session, but then she also is an hourly contractor for me for behind the scenes stuff. So she really gets paid for the session at a higher rate for her health coaching. But then when she's doing kind of follow up with the patient and everything, she's getting paid her hourly rate for working for me anyways. So that's how I do it with her, since she provides both roles. But yes, I do think that what the system I have set up really works. And I'm not going to just shut it off to new patients. Like, I will figure out a way to, expand what I'm doing to reach more people.
Well, since we're on the topic of logistics, you mentioned that there are, as part of the package, you run these core labs. So I'd love to know what those are, but I also would love to know how, if at all, your health coach engages with lab results. How, and I'm asking this question very vaguely because I want to hear, I don't want to set it up any more than that.
Yeah. So I start with every patient. I do an salivary adrenal test on all of them. I believe adrenals are foundational to health, and everybody's are not exactly where they're supposed to be. I mean, I've ordered hundreds of these tests. I think I found 2 normals in the ones that I've tested. Now, this is a biased population, right? Because people that are resonating with my messaging are the ones that are having this testing done. So I do believe there are people who have normally functioning adrenals, but the ones that come to me do not. And so I start with a salivary adrenal test. Then we spend a few months kind of optimizing the adrenals, which I believe is foundational to their immune system healing to be able to handle bigger things later on. Then I do a GI map from Diagnostic Solutions. So we test the gut, we see who's living there, the bad guys, the good guys, the intestinal health markers. And we spend about 3 months optimizing the gut. And then I move on to a comprehensive organics acids profile. I tell my patients when we're testing the mitochondria, how your body makes energy, your brain health. We look at the liver toxins, and then we get kind of some gut markers on there too to see how well we've done at cleaning up the gut, so to speak. So they get these 3 core labs, one at the beginning, one 3 months later, one 3 months later. And that's when I have the sessions with the patient. I really explain to them what it means. I create a protocol of what we're going to do to heal what needs to be fixed and healed based on the lab results. And then my health coach really more helps them with the lifestyle modification and sticking with the plan and all of that. So she doesn't do a ton with the labs. I mean, she helps, us get them ordered and get them, help them do all of that. But I do that part mostly myself. And then she helps them, stick with the plan and because we can be heavy on lifestyle and low on supplements, or heavy on supplements and low on lifestyle, right? And I think the sweet spot is when we can really do them both. And the supplements are never meant to be forever. They're meant to fix a problem and then get off of them.
Yeah, I love that. And look, the reason Erin, I think, was asking is this is rampant in the health coach community, coaches that want to be able to order and interpret labs. I guess depends on the labs, but we have been adamant saying that's not coaching. Yeah. We also believe that it might not be legally where you live, but that's really not within the scope of a coach.
Right.
And so I was, just curious as to kind of your opinion there on, are there some labs that you think are probably fine for a health coach to kind of take a look at? But the thing is interpreting these things is not easy.
No.
Figuring out kind of what all this really means, especially in the holistic picture.
Right.
Right. And understanding all of this. So I would love your point of view on kind of.
Yeah, that is so interesting. I see this come up in some of the Facebook groups I'm a part of. There's a functional medicine lounge Facebook group, and they're mostly MDs and DOs that are functional medicine certified. And they feel like our toes are being stepped on by health coaches ordering labs. My thought is there's enough patients to go around and we can all help people. So I don't feel threatened by that. But I do think there is just a depth of knowledge that I have received from my years of training that make me more just better trained to interpret those labs, just like the health coach is better trained than I am to help them implement the lifestyle. I am better trained at understanding all of the background. And it's not without some risk, there is some risk with that. And so I think, I feel more comfortable handling that part. And my health coach too, she's very careful to, she doesn't want to step outside of her bounds. I mean, she knows I'm not meant to diagnose and treat. And, she gets pretty uncomfortable when patients are asking her oh, what should I eat exactly? And some of this stuff, and she doesn't want to, and it's a little bit of a unique situation when you're working with a physician, because you have some, what's the word I'm looking for? She can do some things under my umbrella.
Protection, maybe.
She's got some cover.
Yes. Yeah. I think back in my old office, my nurse would call in prescriptions for me all the time. Well, my nurse isn't qualified to call in prescription. She doesn't have prescribing power, but she's calling it on my behalf. So when I tell my health coach, Lydia, I'm like, okay, I really want them to be on this diet. And then she can help them implement that. It's not outside of her scope because I am prescribing it. She's helping them implement it, so we keep pretty clear boundaries with that. She actually, I think, is a little bit more timid. I'm like, no, that this is how I do it. And it's okay. But she kind of likes that reassurance from me. This is, are you okay with this? This is what you're going to tell them, because she very much sees her role as a change agent for them, not as somebody who wants it. And I think what can be hard for health coaches, lots of times people that go into health coaching, they go in because they've figured out a lot on their own.
Yeah.
So they know a lot. And, I think patients sometimes want some of that too. And so, trying to find that perfect sweet spot can be, I think, really, really challenging. And it has been for my health coach too. But I try to tell her, like, you've got the umbrella of me, I have the capacity to do that. And you are working through me. And so you can tell them these things.
Great. I'm glad to hear that Lydia is cautious about that. Actually, we're staunch advocates for scope of practice.
Absolutely.
But like even the example you gave of if you prescribe a specific diet, whatever, low FODMAP. So like health coaches aren't allowed to prescribe diets. And we're not allowed to do, in most cases, generally, this is out of scope of practice for health coaches to do prescriptive diets. But this is exactly what we're talking about. This is the nuance. It's like if a doctor says Bob Jones needs to be on low FODMAP, Bob Jones now goes to the health coach. The health coach is facilitating low FODMAP.
Exactly.
Like that, I think a lot of coaches wonder, like a coach themselves might have put themselves on a low FODMAP diet and cured their whatever. And they know the low FODMAP diet in and out. And so it's sort of like, this is the nuance between when the health coach makes it prescriptive or when the health coach is simply facilitating somebody through it. It's like a lot of semantics involved with scope of practice. And this is when we train health coaches and they want to understand, like, what can I and can't I do?
Right.
Honestly, our answer typically is just watch your language, watch what you're saying. Like, I'm not prescribing you the low FODMAP diet, but here's resources about low FODMAP and I'll help you facilitate it.
Yeah,
it's very, very nuanced. And I think that lack of black and white clarity in terms of like, what can we and can't we do is where coaches get tripped up. And then when they get tripped up, they always, for some reason, not always, often for some reason, skew to the side of playing doctor. And it's like, maybe don't skew that way.
Yeah.
So we're all figuring it out as this profession continues to blossom. We're figuring it out. Yeah.
I think I think patients think that they want those concrete answers. And because that's what you're sensing they want, you want to give it to them. But sometimes what they really need, it's like, instead of giving them fish, you teach them to fish, I mean, it's so much more helpful to them in the long term, but you at the same time want to keep them committed and interested and feeling like it's helpful too. Like, you don't want to just you don't want them to leave the visit and be like, well, I didn't get anything out of that. Like, they're not telling me anything, So it is an art for sure, is to try to give them enough. But truthfully is we want them to find the answers within themselves to be able to do it all. Like I tell my patients this all the time too. I have done so many 30-day plans that I will never do another one again. Like I have done so many times where I have 30 days, no sugar, no flour, and I can do it. And I mean, I can see results. I mean, I can lose 5 to 7 pounds. I feel really amazing. But guess what I do on day 31?
Yeah.
Like one day I ate 4 donuts on day 31 because I was so craving sugar. I could not wait for it. And I couldn't decide what kind I wanted to have. And so over the 30 days, I just envisioned all the donuts that I love and I ate 4 donuts. And so I am not all about that anymore. I'm like, we can get there the fastest if we just cut all the junk out and we do balls to the walls and we're just going, right? But can we stay there? Because guess what? Staying there is not easy either. Right. So I'm more interested in, let's take more steps forward than backwards.
Yeah.
We're moving there. We're not going to get there quite as quickly, but we're going to be able to stay there in a way that's sustainable forever. So I'm all about forever change, not fast change. And so is my health coach. And we try to kind of help them find that plan and, walk it together. That. Yeah. Everything we do is information, even when it doesn't work. I give this example to my clients a lot. It's like the game of Clue. Have you ever played Clue? Yes. And I'm like, well, it's not Colonel Mustard in the study with the rope, we figured out that it isn't that, but that's narrowed and helped us hone in like, okay, it's not that. What else can it be? So even when it's not working, it's still helpful. It's like a big, scavenger hunt, kind of trying to figure out exactly what's going on. And I love when my patients get a glimmer of feeling better, even if it doesn't last. So like when they have a moment where things get a lot better and they say it lasts for a weekend or a week or whatever, and then they kind of fall back down into their previous symptoms and stuff, I say the fact that your body was able to feel amazing is such a good sign. Like we know that it can do it. We just need to kind of find that secret sauce formula to get it there again. But it's not, functional medicine is not the quick fix. Neither is health coaching, right? It's the long game. But if, just like in the business, if you're consistent with it, if you're consistent with some of these health hacks and different things that you learn about your body and you just keep repeating it, like we're all interested in the shiny object, right? We all want that quick thing that's going to just make us feel amazing, or that's going to make our business just go to the next level. It's not nearly as sexy as that. It's the like long, boring, day in and day out, providing your body with the fuel it needs. I mean, I really think of it as simple as giving your body what it needs to function optimally and removing what is preventing it from functioning optimally. It's not 72,000 different things that can go wrong. It's really as simple as just that.
Yeah.
But that's not the quick, easy fix, right? So for somebody who's looking for, hey, you give me a pill, I want to feel better in 2 weeks, out of here. Like those aren't our people, right?
Good advice for life. Do the things that work and don't do the things that don't work.
Yeah.
Not sexy, but it works.
Exactly.
Yeah,
exactly.
This is great. We learned so much. This is what a great conversation. And I think, kind of to Laura's point earlier, this is a potentially growing field, a career field for health coaches. And so, understand what doctors are looking for, understand the frustrations that doctors are feeling. The functional medicine practitioners are functional medical practitioners for a specific reason. They extricated themselves from the conventional medicine realm for a reason. So understand that and figure out how your place in it, because it's growing and growing and growing.
Right.
Yeah.
Absolutely. I think all functional medicine providers need health coaches, and I think most of them desire to have them to work with them. And I think it's just such a great partnership, and it doesn't have to be done in lieu of pursuing your own path. It can be done in conjunction too. I mean, I really feel like the people I meet in this space are just also passionate about the same common end goal, right? It's just, it's like we have answers, we can help people, we know how to do so, and we just want to get out there and do it.
I love that. Yeah. So like, I hope what coaches or potential coaches listening to this take away is there's more than one right way to do this. Mm-hmm. You don't have to carry this mantle alone. There are people just like you that hold different skill set than you, a different education than you, play a different role than you, that you can all work together to advance this message. Thank you so much for just your passion and your knowledge and your enthusiasm for kind of what we're all doing.
Oh, thank you so much for having me. This has been a really, really fun conversation.
Yeah. So how can people find you?
So I have a business. It's called Best Life Functional Medicine. So my website is www.bestlifefunctionalmedicine.com. And I work one-on-one with patients in the state of Ohio. As a doctor, you can only work with patients in your state. I do have an online program that people can take anywhere. It's called From Fatigue to Flourishing. It's an online adrenal program where I teach people how to DIY your adrenals and fix them for yourselves. And then my newest thing is I have written a book. Ooh. So I have a book now. It's called The Path of Intention, 5 Factors to Optimize Your Health and Create a Life You Love. And this is where I talk about, the diet, the exercise, the sleep, the relationship, and the mindset. And so, I'm passionate about just extending the message of functional medicine and holistic healthcare beyond the scope of what I can do one-on-one. And so I'm excited to have the book that's something that anybody can read from anywhere.
Awesome. And what a great resource too, for health coaches that might not be in Ohio, but want to be able to kind of spread this message to their clients. So thank you so much. This has been so great.
Yeah. Thank you so much for having me. I really have enjoyed this conversation. It's been fun.
Yes.
This podcast was brought to you by Primal Health Coach Institute. To learn more about how to become a successful health coach, get in touch with us by visiting primalhealthcoach.com/call. Or if you're already a successful health coach, practitioner, influencer, or thought leader with a thriving business and an interesting story, we'd love to hear from you. Connect with us at hello@primalhealthcoach.com and let us know why we need to interview you for Health Coach Radio. Thanks for listening.